Hello everyone, welcome back. In today's session, we'll be practicing MCQ from mental health nursing. Okay, so let's start. Which organization gave the following definition of mental health? What is the definition now? A state of well-being in which every individual realizes his or her own potential, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to her or his community, right? So this will be option B. WHO has given this statement, okay, or definition. So option B will be the correct answer. Now coming to question number 2. Which of the following is not a characteristic of mentally healthy person? Option A, ability to perform activities independently, ability to make adjustments, feeling insecure, ability to cope with daily pressure of life. So, because see, all are the characteristics of mentally healthy person, but see option C, feeling insecure, it is not a characteristics of mentally healthy person. This is basically a mentally unstable or unhealthy person, right? So let's see now what all are the characteristics of mentally healthy person. How you feel about yourself and how you adjust to life events. Clear? Ability to make adjustment, have sense of personal worth and feel worthwhile. Ability to make adjustment and solve his problem largely by his own effort and makes own decision. मतलब क्या है, वो एडजस्टमेंट कर सकते हैं, मतलब खुद को मतलब वर्दी समझते हैं, क्योंकि डिप्रेशन में हम देखे हैं ना, फील वर्थलेस, होपलेस एंड हेल्पलेस. So, but in mentally healthy person, you will be seeing that person is having the sense of personal worth and feel worthwhile, ability to make adjustment, मतलब वो जो भी सिचुएशन होगा उसमें एडजस्ट कर सकते हैं, solve his problem largely by his own effort and makes own decision, मतलब किसी के द्वारा मैनिपुलेट नहीं होके खुद का डिसीजन खुद ले सकते हैं. क्लियर? हैव सेंस ऑफ पर्सनल सिक्योरिटी एंड रिस्पॉन्सिबिलिटी, जो डेली का एक्टिविटीज है या ड्यूटीज है वो सब कर सकते हैं. देन ही कैन गिव एंड एक्सेप्ट लव, लव दे भी सकते हैं, लव एक्सेप्ट भी कर सकते हैं. शोज इमोशनल मैच्योरिटी इन हिज बिहेवियर, मतलब इमोशनली भी मैच्योर है, मतलब कुछ हो गया या कुछ खुद के फेवर में नहीं है, उसी के टाइम में खुद को ब्लेम नहीं करेगा. ठीक है, मतलब इमोशनल मैच्योरिटी है. एबिलिटी टू परफॉर्म एक्टिविटीज इंडिपेंडेंटली, खुद से अपना काम कर सकते हैं. पॉजिटिव एटीट्यूड टुवर्ड्स सेल्फ एंड अदर्स, जो व्यक्ति हर चीज में पॉजिटिविटी देखते हैं, मतलब पॉजिटिव एटीट्यूड टुवर्ड्स सेल्फ, मतलब खुद के ऊपर भी एंड दूसरे के ऊपर भी. ठीक है, होप इट इज क्लियर. नाउ कमिंग टू नेक्स्ट क्वेश्चन, व्हाट इज दैट? which of the following is not a sign of poor mental health? ठीक है, मतलब क्या पूछे, ये जो नॉट, यू हैव टू मार्क दिस नॉट फर्स्ट बिकॉज दे हैव आस्क्ड कौन सा नहीं है, पुअर मेंटल हेल्थ में कौन सा नहीं है. ठीक है, अनरिजॉल्व कंफ्लिक्ट, लैक ऑफ सेल्फ कॉन्फिडेंस, पॉजिटिव एटीट्यूड, इमोशनल इंस्टेबिलिटी. ठीक है, सो देखो, मतलब जो अच्छा है वो तुम्हें ढूंढना होगा. सो सी पॉजिटिव एटीट्यूड, इट विल बी सीन इन मेंटली हेल्दी पर्सन, एंड अदर्स जो बाकी 3 ऑप्शन है उसमें सारे चीज पुअर मेंटल हेल्थ पर्सन को दिखने को मिलेगा. क्लियर? नंबर 4, आ साइकेट्रिक इलनेस इज मैनिफेस्टेड बाय डिस्टर्ब बिहेवियर, इम्पेयर्ड फंक्शन एंड पुअर फीलिंग, अनपॉपुलर बिलीफ, गुड कंसंट्रेशन एंड मूड स्विंग्स. सो दिस विल बी द करेक्ट आंसर. डिस्टर्ब्ड बिहेवियर, इम्पेयर्ड फंक्शंस एंड पुअर फीलिंग. Clear? Now coming to next question, what is the primary role of the psychiatric nurse in the management of patients with mental health disorder? मतलब क्या बोल रहा है कि साइकेट्रिक नर्स में मतलब नर्स का क्या रोल है ना, प्राइमरी रोल क्या है. तो देखो ऑप्शन क्या है. प्रिस्क्राइबिंग psychiatric medications, conducting psychotherapy session, providing holistic care and support, administering ECT. So we know, right, option E is not correct answer because this is basically a doctors who all are prescribing medication. Then conducting psychotherapy, that also generally doctors do. Then we can assist, right, but we are not conducting that. Then providing holistic care and support, this can be given by nurse, right? Administering ECT, here also nurse assist. Clear? Psychiatric nurse is working in various settings related to mental health, example OPD, IPD, ECT. See, मतलब हर जगह में तुम काम करते हो, right? बट साइकोथेरेपी यूनिट, कम्युनिटी मेंटल हेल्थ एक्सेट्रा, मतलब इस सारी चीज में तुम असिस्ट कर रहे हो, एक्सेप्ट ऑप्शन सी, ऑल अदर आर फंक्शन ऑफ डॉक्टर एज आई हैव टोल्ड. क्लियर? नाउ कमिंग टू नेक्स्ट क्वेश्चन. One of the general principle of psychiatric nursing is option A, reassuring the patient all the time, use self-understanding as a therapeutic tool, repeated talking with the patient, giving expert advice. Okay, so what will be the correct answer? Let's see. Option B. Okay, use self-understanding as a therapeutic tool. Okay, though let's say reassuring the patient all the time, it is also necessary, but not that much. Like, it is not a general principle, right? Repeated talking with the patient, that may irritate patient sometimes. Okay, giving expert advices, sometimes patient may not be able to take your advice sometime, right? So option B will be the correct answer. Okay, now coming to what is the primary focus of mental health and psychiatric nursing. Option A, providing physical health assessment, promoting mental well-being and addressing mental health issues, administering psychiatric medications, conducting surgical procedure. So what will be the correct answer? This is option B, promoting mental well-being and addressing mental health issue. Clear? Number 8, what are the trends in psychiatric nursing? Certificate program for graduate and experienced nurse. Then custodial care, practice of nursing in new and emerging role. Then dilemmas in care. So see, practice in nursing in new and emerging role. This is the trend. Have to remember that. Okay. What are not the misconception related to mental health? मतलब जो misconception कौन सा नहीं है? You have to again mark the not. You have to mark the not here because negative जो question होते हैं ना वो ज़्यादा confusing होते हैं. That's why I am focusing on those questions mostly. Children do not experience mental health problem. Mental problems do not affect health. It is possible to prevent mental health illness. People with mental health problems are violent and unpredictable. So option C will be the correct answer, right? It is possible to prevent mental health illness. This is not a misconception. बाकी सारे misconception है. Okay? क्योंकि लोग सोचते हैं क्या कि बच्चों का नहीं होता है एंड ये हेल्थ को अफेक्ट नहीं करते हैं. ये सारे मिसकंसेप्शन है. ठीक है. एंड इट इज पॉसिबल टू प्रिवेंट मेंटल हेल्थ इलनेस. या दिस इज द राइट वन, राइट? इट इज नॉट द मिसकंसेप्शन. सो दिस विल बी द करेक्ट आंसर. नाउ कमिंग टू क्वेश्चन नंबर 10. मतलब WHO आइडेंटिफाइड मेंटल illness as accounting for what percentage of global burden of disease? That is 14%. Okay, according to an analysis done by WHO, global burden of disease 2000 shows that neuropsychiatric, mental and neurological conditions and substance use disorder had account for more than 10% of global disease burden. Okay, so you have to remember that around 10%, right? So nearmost answer will be 14% here. Clear? Now coming to next question. Standards of mental health practices are published by Trained Nurses Association of India, American Nurses Association, State Nursing Council, Indian Nursing Council. So who have given or published So that will be American Nurses Association. In 1982, the standards of psychiatric and mental health nursing practice were published by ANA. What is that? American Nurses Association. It is clear? Coming to next 12, ICD-X classification is used in Central Sterile Supply Department, CSSD, no. Operation Theatre, no. Medical Record Department, yeah. Kind of. Blood Bank, no. Okay, so option C will be the correct answer. Clear? International Classification of Disease, 10th revision ICD-10 is designed to promote international comparability in the collection, then processing, classification and presentation of mortality statistics, which may be used by MRD. Clear? Now number 13, according to ICD-DSM classification, mental and behavioral disorders due to use of psychoactive substance belong to. Okay, so what they have said, mental and behavioral disorder due to the use of psychoactive substance belong to, that will be F10 to F19. Sometimes you have to remember that ICD classification, okay, that if 20 to 30 like that, you have to remember like basic important things. See, ICD-10, mental and behavioral disorder due to psychoactive substance use, code range of F10 to F19. For details ICD-10 refer theory part. Okay, we will study in theory part. Clear? All of the following are neurotic disorders except, देखो, schizophrenia, anxiety, OCD, exogenous depression. So what will be the answer? Try to answer also, okay, by your own. Don't see the answer all the time. So that will be the schizophrenia, okay, because it is not a neurotic disorder. Anxiety, OCD, exogenous depression, all are neurotic disorder. Okay. According to Indian classification, mental disorder are classified into neurotic disorder, that is psychotic disorder and special disorder. Neurotic disorder, minor mental disorder, OCD. Somatoform example is conversion disorder, anxiety, exogenous depression, phobia, hypomania, etc. Psychotic disorder, major mental disorder, that is functional psychosis, that is schizophrenia, mood psychosis and organic psychosis. So basically it is a psychotic disorder, right? Schizophrenia is a critical one, like most severe form of mental disorder is schizophrenia, where functional psychosis is seen. Clear? And others option, that is OCD, then anxiety and exogenous depression, all are neurotic disorder. Next question. All of the following are neurotic disorder except, okay, conversion disorder, mania, exogenous depression and phobia. So we have seen, right, conversion disorder and then exogenous depression and phobia, all are neurotic disorder. In this point only we have studied. So mania is not a neurotic disorder. Then the test for assessing patients' orientation and recall, Beck Depression Inventory, Thematic Appreciation Test, Mini-Mental Status Examination, then Millian Clinical Multi-Axial Inventory. No, that will be, what will be the answer? That will be option C. See, Mini-Mental State Examination, what is that? A commonly used assessment tool to quickly assess a person's 5 area of cognitive function. Example क्या है? Cognition, registration, attention and calculation, recall and language. Okay, it scores from 0 to 30, score of 25 to 30 indicating intact cognition or insight, 18 to 24 indicate mild to moderate, and score below 17 indicates substantial impairment in ADL. Okay, activity in day to life. Okay, so thematic appreciation test, a test used to assess insight into subject's personality by showing picture of life situation that could be interpreted in several ways. Okay, subject is asked to provide a story of what the picture represent. मतलब क्या है, इसमें एक पिक्चर दिखाते हैं लाइफ सिचुएशन के बारे में, तो उसके बारे में पूछते हैं, है ना. थीमेटिक एप्रिसिएशन टेस्ट. बेक डिप्रेशन इन्वेंटरी, व्हाट इज दैट? इट इज अ स्केल यूज्ड टू assess level of depression. Okay, you have to remember the other 3 option as well, that why it is not right one. Okay, that's how you can cover 3 more question. Clear to all of you? Now coming to next, mini-mental status examination, that is MMSE, does not include cognition, insight, perception, history of psychiatric disorder. So what will be the correct answer? Option D, right? All 3 is seen in MMSE, but history of psychiatric disorder is not a characteristic, right? Now, what is the maximum score of MMSE? That is 30, right? See, yeah, option D is the correct answer. Now only we have studied. Now 19, a structured assessment of the patient's behavioral and cognitive functioning is called. What is called? That is option C, mental status examination. Behavioral and cognitive functioning is called mental status examination. See, it is a systematic evaluation of all area of client's mental functioning. Example, general appearance and behavior, speech, thought, mood, affect, perception and cognitive function. It includes consciousness, orientation, attention, intelligence, memory, concentration, abstraction and judgment. Hope you have remembered the MSc and MMSc. Okay, both are very important from exam purpose. So you have to remember all these points, that what all are the criteria is fulfilled in each assessment, right? So MSc is used to determine whether a person is experiencing abnormalities in thinking and reasoning ability and feeling or behavior. Okay, it is used basically to determine the abnormalities in thinking and reasoning ability. Okay, now 20, all the following are the components of cognitive assessment except. Okay, so what is that? See, attention, concentration, intelligence, judgment, consciousness. So cognitive assessment में मतलब क्या है? जो मतलब दिमाग का खेल है ना, तो consciousness is not under cognitive one. This is another criteria itself. Clear? So all other 3, it is the part of cognitive assessment. Clear? This and this all are cognitive assessment except consciousness. Now coming to 21, systematic evaluation of behavior, emotion and cognitive functions of individual is known as mental status examination, history collection, neurological examination, process recording. So systematic evaluation, it will be mental status examination. Clear? Now, which of the following is the first step of MMSE? Yeah, this is a very good question. Let's see. General appearance and sorry, I have told the correct answer only. Okay, option A is mood and affect, then general appearance and behavior. Option C is speech and higher cognitive function. So correct answer will be option B. Okay, the most common assessment for mentally ill patient is done by taking psychiatric history, doing neurological examination, then electroencephalography, mental status examination. So that will be obviously mental status examination. It is the most common assessment for mentally ill patient because we are doing for every patient almost. Okay. MSc is important tool to assess mental ill person, although taking psychiatric history is also important to diagnose mental illness. Okay. Number 24, asking a patient about date, month and year would help to assess. This will be would. Okay, so that will be orientation. Clear? Clear to all of you? Orientation means the ability to understand and recognize correct about time, like date, month, day, night, place. इसमें क्या है? Name of the city and hospital. Person में क्या है? Identity, name of self and staff. Okay, all this will be asked to patient. A nurse enters the room of a patient with a cognitive impairment disorder and asks what day of the week it is, what is the date, month and year are, then where the patient is. Nurse is attempting to assess what is that. That will be obviously orientation. Now we have discussed in last question. Okay. Number 26. During a mental health assessment, which of the following is essential for gathering subjective data about a patient's mental state? So, patient subjective data means what? What patient is telling, right? And objective means what you are observing. So, for that subjective data assessment, what you have to do? First one is physical examination, observation of behavior, laboratory test, medical history review. So, let's see. Physical examination it will be needed, but not for subjective. It is for objective one, right? Observation of behavior. Yeah, this will be the correct answer. Okay, because when patient is telling, suppose that I am having abdominal pain. So how you will understand that the pain intensity? For that you have to observe the patient's expression and then only you can score, right? So for that observation of behavior is necessary. Now number 27. You tell a 65-year-old patient, listen carefully and repeat after me. Apple, pen, table. If he repeats these three words immediately after you in correct sequence, he is normal. Option A, judgment, recall, orientation and registration. So what will be the correct answer? That will be recall. So patient can recall all three names, right? Recall is act of bringing back to mind something previously learned or experienced. Ask to repeat name of three objects repeated above. Apple, pen, table. 1 marks for each correct answer. Okay. Then recall used to assess recent memory. Clear? Now number 28. Recording of conversation between nurse and patient in psychiatric setup is termed as. So what we are doing, nurse and patient का जो conversation है वो recording कर रहे हैं, तो उसको क्या बोलते हैं? It is called as process recording, right? We know. So options are therapeutic communication, interview technique, case study. No, these all three will not be happen. So the correct answer is process recording. It is the recording of conversation during interaction or interview between the nurse and the patient in the psychiatric setup with the nurse's inference. Okay. 29. An exact written report of the conversation between the nurse and the patient. It is non-verbal record, nurse record, process report. Oh, it is called process record. Okay. So exact written report of conversation between nurse and the patient, it is called process record. Number 30. A biological factor which causes abnormal behavior in mentally ill patient, it is higher education, unemployment, your poverty, then changes in neurochemicals. So biological factor means this one, right? Changes in neurochemical. All are the external things, and this is something internal and biological. Okay. So this is the etiology of mental illness. See, biological cause, this is hereditary, inherited characteristics, brain damage due to infection, injury, biochemical factor or change in neurochemicals. Example is increase in dopamine cause schizophrenia and decrease cause Parkinsonism. And physical deprivation like malnutrition and sleep deprivation. Then psychological and physiological, right? Change in body during puberty, menstruation, pregnancy and puerperism. That is physiological. And psychological like strained IPR, matlab interpersonal relationship, maternal deprivation or harsh parenting. Then social culture factors like unemployment, injustice, insecurity, alcohol and other drug use. Clear? Number 31. Which statement about causation of mental illness would the nurse identify is incorrect? Option A. Life circumstances can influence one's mental health from birth. The inability to deal with environmental stresses can result in mental illness. Mental health is influenced by relationships between persons who either love or refuse to love one another. Inherited characteristics do not influence one's mental health. Okay, so option D will be the correct answer. Inherited characteristics do not influence one's mental health, because heredity is a factor, right? We have studied that heredity is an important factor for causing mental illness. So this is the incorrect statement. Now 32, sleep deprivation leads to psychotic behavior, decreased mental alertness, emotional disturbance, anxiety, neurosis. So what will be the correct answer? That will be option C, emotional disturbance. You can see in yourself as well, like when you are having sleep deprivation, right? So you won't be able to deal the things the way you used to do earlier, like in healthy state. So that is basically emotional changer, right? Then 33, minimum duration of sleep required daily and average healthy adult. What is that? That is option D, 7 to 8 hours it is told, so 7 hours will be the correct answer. Adults sleep 7 or more hours daily on a regular basis to promote optimal health. Sleeping less than 7 hours on a regular basis is associated with adverse health outcomes like diabetes, hypertension, heart disease and stroke, depression and increased risk of death. Can you see that all these things can happen if you are having sleeping deprivation? 34, a characteristic of infants and young children who have experienced maternal deprivation is tendency toward overeating, responsiveness to stimuli, proneness to illness and extreme activity. Okay, so proneness to illness. Okay, maternal deprivation means the child is derived from maternal stimulation of mothering, caring and affection. This deprivation may predispose for abnormal behavior at a later stage of life. Okay. Now, which of the following are risk factors for childhood psychiatric disorder? Parental psychopathology, repeated early separation from parents, then harsh or inadequate parents, all of the above. So basically all are the responsible factors for childhood psychiatric disorder.